Faslodex IM injection instructional video. Each Faslodex box contains 2 pre-filled syringes containing 250 mg fulvestrant in 5 ml solution and 2 21-gauge hypodermic needles with safety glide shielding. Peel open the safety needle outer packaging. Remove glass syringe barrel from tray and check that it is not damaged. Inspect visually for particulate matter and discoloration. Hold the syringe upright on the ribbed part. With the other hand, take hold of the cap and carefully tilt back and forth until the cap disconnects and can be pulled off. Do not twist. Remove the cap in a straight upward direction. To maintain sterility, do not touch the syringe tip. Attach the safety needle to the syringe tip and twist until firmly seated. Check that the needle is locked to the connector. The Faslodex injection is now ready for administration. Dorsogluteal site is quite a familiar site for intramuscular injections. The dorsogluteal injection site lies in the upper outer quadrant of the buttock. In order to identify the dorsogluteal injection site, you must visually dissect the buttock into 4 equal quadrants. The upper outer quadrant is the injection site for dorsogluteal IM injection. Sterilize the area of injection with an alcohol swab. Once you have prepared the injection site, pull the needle shield straight off to avoid damaging needle point. Expel the excess gas from the syringe before injecting. Insert the needle at 90 degrees angle until the needle reaches the intramuscular layer. Administer the injection intramuscularly by pushing the plunger slowly over 1 to 2 minutes. Ensure that the injection fluid is completely administered before you take out the needle. After the injection, immediately apply a single finger stroke to the activation assisted lever arm to activate the shielding mechanism. Please note a few important considerations while administering intramuscular injections at dorsogluteal area. Determine injection site carefully to avoid injury to sciatic nerve. Ensure that needle is truly in the muscle and not the subcutaneous layer. This may lead to increased risk of local side effects, such as abscess or granuloma formation. Let us see what can be an alternative site for intramuscular injections. The ventrogluteal site. This site is preferred for intramuscular injections because of the following features. It is free of major nerves and blood vessels. The muscle tissue is thicker than the dorsogluteal site, and the subcutaneous layer is thinner. Therefore, there is a low possibility of a subcutaneous injection. Is it easy to identify a ventrogluteal injection site? Yes, it is. Let's see how. Ask the patient to lie on their side. Place the heel of your opposite hand on the greater trochanter, that is, your right hand on their left leg, and vice versa. Now, locate the iliac spine by placing the tip of your index finger on the anterior superior iliac spine. Make sure that your thumb is always pointing towards the front of the leg. Keep your index finger on the anterior iliac spine. Spread your middle finger away towards the buttocks to form a V. The injection site is in the middle of the V, which should be level with the knuckles of your index and middle fingers. Once you have located the ventrogluteal site for injection, sterilize the area with an alcohol swab. Pull shield straight off the needle to avoid damaging the needle point. Expel excess gas from the syringe before injecting. Remove your hand before injecting to avoid a needle stick injury. Insert the needle at 90 degrees angle until the needle reaches the intramuscular layer. Administer intramuscularly by pushing the plunger slowly over 1 to 2 minutes. After injection is delivered completely, take out the needle. Apply a single finger stroke to the activation-assisted lever arm to activate the shielding mechanism. Thank you for your attention.